Hello, everyone, and welcome to our Pearl webinar. We are very excited today to have everybody here with Dr. Alderman, and we're going to give everybody just a few minutes to jump in. Again, some of you joining us from the West Coast, just getting started, and on the East Coast, probably lunchtime, and in the middle of the US, right? You're right in the middle of your day. So thank you again for joining us. Happy to have you here for this very exciting conversation. We would love to hear where you're joining us from. Dr. Alderman, where are you joining us from?
I'm actually in Fort Lauderdale, Florida today.
And I'm exactly on the other side of the United States. I am in California, and I know Kimberly,
Oh,
who's joining us today, she's also in Arizona. So again, we are going to try out the Q&A section or the chat bot with you guys. We're going to have a lot of time to ask Dr. Alderman some questions at the end. Feel free to jump in the chat and let us know where you're coming from. And also, if you'd like to let us know if you're a dentist, hygienist, assistant, front office. We'd love to get to know the audience. We're going to do some interactive games and such. So we'd love to make this a little more interactive if possible. All right, I'm going to go ahead and jump in and get started here. I am Sheela Roth, Head of Clinical Education at Pearl, and welcome you to today's webinar, AI in Communication in Dentistry. We are proud to bring this event to you in partnership with Patterson Dental. I'm also joined today by my colleague, Kimberly Kwiescien, our Director of Partner Growth here at Pearl. Together, we're passionate about helping practices thrive by combining clinical excellence with smart, scalable technology. Let me start with a question. What if improving how we communicate with patients could not only reduce team stress, but also significantly increase treatment acceptance using the power of AI? That's exactly what we're here to explore today. In this session, while we're together, we're going to talk about how you don't have to do a lot of different things here. Everything you're doing is great, and how small tips with modern AI tools will transform communication in dentistry, making it easier for teams to educate patients, buy back some time. And also, you're going to hear about practical examples, tools you can implement right away. And really interestingly enough, get behind the eyes of what the patient is seeing, right? They're now able to see what we see as clinicians. Now, to guide us through this exciting topic, we are honored to welcome an incredible guest speaker today, Dr. Kathryn Alderman, a seasoned dentist, entrepreneur. I probably need a half an hour to introduce you, but I'm going to try to keep it short. An AI advocate with over 20 years of clinical and business experience, very unique because after scaling her own practice into a successful network of over 7 practices, she earned an MBA and then went on to complete an AI product design training at MIT. So I don't know much more what else you could do here, but she is also the founder of Intelligent Care Alliance and the creator of, tell me how to say this, Dr. Alderman, Yucatarian?
it's actually Kathryn. It's my first AI product that I created while I was in MBA school, and it's after my grandma. So that's
Oh my
and it's
goodness,
actually my full name. My name in Russian, Yekaterina, but nobody can say it, including me. So
including me.
including me. So that's why, and it's really, really difficult to find names for AI products. So one day I woke up and I thought I will do it in honor of my grandma.
Oh, I love that. That
So
is so, so great. Well, we are so honored to have you today. I will turn it over to you and let you take it away. And thanks again for joining us.
And I love to say thank you, Sheila. Thank you. Sheila has been just a very wonderful person to work with at Pearl. And we end up talking a lot, and she really helps me to prepare for presentations. And what I love about Sheila is that she understands, as a former hygienist, what it's like to talk to hygienist, what it's like to talk to dentist, and what it's like to have a patient in front of you that has dental needs and yet may not believe the urgency of needing to fix it. So Sheila, thank you so much for making this happen. Thank you for connecting with me. And I'm excited to talk about a very important topic today, how to help patients to hear us. Can you hear me well? Can you hear my volume well?
Absolutely. We can hear you great.
So let's do it. Before I start, I want to say thank you. Thank you to Patterson Dental for bringing this webinar to you. I want to, of course, say big thank you to Pearl. The future of dentistry is powered by AI, and Pearl is one of the leaders in this area. I also want to tell thank you to ChatGTP for helping me to create QR codes and content. And I want to thank Gamma AI for making this presentation to be much easier project than it used to be. And I want to thank LeeChat Images for helping me to create images. I love that to create images. And I want to thank my team at Intelligent Care Alliance for helping me to deliver this content and to help me for helping me to support dental offices, not just in the United States, but globally. So thank you to everybody. This is not just a product of my work. This is a product of many humans and AI products working together. So I wanted to, so when people ask me what I do, it's a lot to say. But really, what I have been doing for the last 20 years is helping growing dental practices, training dental teams, training hygienists, training dentists, training business coordinators, and seeing patients. I have been a very busy full-time working mom, a business person, and I have 3 kids, but I have my 2 girls plus my dog here. So I have my 3 girls here. And so I am a very busy mama. I know what it's like being busy. I know what it's like working full time and then needing to go home and being with my kids and wanting to be with my kids. So my passion for AI is really has a good reasons that for 20 years I don't know how I did it. I honestly don't know how I did it. Growing multiple dental locations, doing marketing, dealing with a hygiene shortage, dealing with a COVID um, challenges, and building dental startups. And I don't know how I did it. Honestly, I don't know how I did it while being a wife and a mother and a friend. But so when AI came out, I absolutely fell in love with the AI. I found an AI to be more helpful and a better assistant than I ever had in my life. And I didn't have to pay for that. So obviously I didn't just fall in love. I became absolutely passionate about AI to support myself as a mother, as a business owner, and support dental offices as well. So my agency, what we do at my agency, we implement AI, we create custom agents, and we really help dental offices to bring AI to the offices and make it easy. So again, I love it. I love it. I do have to say, I feel better. I look better. And I have a better life since AI has entered my life because I don't feel as overwhelmed as I used to for 20 years of running businesses and being a mom before AI came in. So I do feel that every day I wake up, and if I have a challenge, and if I have a big project, and I start getting that feeling inside, how am I going to get it done? Then I remember, hey, can AI help me today? And the answer is always, 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 almost always, yes, it can help me. So today, I'm going to talk about how AI can help you in a patient interaction. Before I do that, I want to say, who do you think is my favorite girl? I just showed 3 of my girls, and I cannot say I have a favorite child, favorite girl, but there may be signs. There may be signs. I just had to share it. So Let's talk about case acceptance. So we're talking about AI and a case acceptance today. Really, case acceptance is a big word. Case acceptance is about trust, communication, and showing value to our patients. Case acceptance in dentistry, when patients will say yes, despite expensive treatment or despite any objections that they have. But sadly, case acceptance in dentistry is really low. We usually have 45% average rate for case acceptance. What it means that if 100 patients come to see us, only 45 patients will complete the recommended treatment, which means there is 20 to 70% of untreated disease that impacts overall health. The good news is that we have 100% potential to change this. How do we change it? Number one, we have to understand why is there such low case acceptance in dentistry. Number one, people don't like dentistry. They just don't like being in our chair. They're fearful. They have a bad perception about dentistry, but also they may lack symptoms. Most dental disease and most gum disease doesn't have any symptoms. So a lot of patients perceive that there is no urgency, there is no pain. They don't see those problems unless it's a broken tooth or something is really hurting them. They don't have the symptoms. We also have to remember there is too many distractions. Disney is competing for our patients' attention. Cruise lines competing for our patients' attention. Car commercials, buying a new home, and on and on and on. Everybody is competing for our patients' attention. So life is very expensive. So that brings us to the next point: cost of treatment. Financial concerns create delay, and our patients don't want to spend money. Something that they don't really want to do, something they don't think they may need. Our patients just don't want to pay for dentistry. On top of it, most patients don't have a good insurance coverage. So there is a very limited or no insurance coverage for treatment. So that makes dentistry not a desirable service to pay for, and for patients to have a low acceptance rate. So let's talk more about attention spans. Everybody's competing for our patients' attention. Everybody's competing for that. And really, our attention spans of our patients really short. So we do have to talk about social media reality and communication challenges. A lot of times when a patient sitting in front of us, we already have a low case acceptance, but on top of it, attention spans are short. So our patients want visuals. They want something bold. They want something visual. They're really trained. Their mind is trained something to get their attention. So how do we do that? Today, we will talk about how to overcome the 5 barriers to case acceptance, how to overcome those barriers to low case acceptance in dentistry, inspired by Instagram and TikTok. How do we do that? Today, I will talk about 5 rules to increase treatment confidence and case acceptance using AI Advantage. Those tips have been tested and proven to be golden rules by working with over 600 dental professionals. So what is the rule number 1? And I will go over in details. What is rule number 1? We have to explain the problem first and the consequences and a solution to the patients. Rule number 2, we have to use visuals. Number 3, we have to use human nonverbal communication. Then number 4, we have to keep our presentation simple, short, just like an Instagram style. And then finally, we have to work with our financial team on scheduling patients and really talking about those finances with a confidence. So let's go through this. Let's go through this. We can overcome barriers to low case acceptance by following those 5 rules. We can do it. And we can do it in any office, regardless of experience or how long we have been in dentistry. If somebody understands those 5 rules, they can have a higher case acceptance starting today. So let's go over it. Rule number one, explain problem, consequences, and a solution. Imagine if you're a patient and if you're sitting in front of me and I'm your dentist, and if I tell you, Miss Sally, you have a cavity that you need to fix, versus if I say this, Miss Sally, most cavities don't hurt. They just start out as a space in an enamel. But as that cavity grows, that cavity reaches into the nerve space. And once that happens, most patients end up having pain and need root canal or removing the tooth. In your case, Miss Sally, that cavity has not reached the nerve yet, so we can fix it with a dental filling and you should be good. That's it. That's it. I explained the problem in general. I explained the consequences, and then I personalized it by telling Sally where her cavity is, and then I gave her a solution. Saying it in this pattern increases case acceptance and a patient's understanding dramatically. So that's rule number one, to explain a problem, consequences, and a solutions as a step one. Notice that I use the visual because seeing is believing. And number one way to increase case acceptance is by catching the scroll happy mind by using visuals. So what is the second rule? Kind of a blends with the rule number one. Use visuals every time. Seeing is believing. If you're talking about a bone loss right here, or if you're talking about cavities, the best is to show visuals. Attention spans are short. Using visuals is a great way to increase it. By increasing attention span, you build trust and increase that case acceptance automatically. And it makes a case presentation day and night. This is what most of us had, and this is what you can have by using a diagnostic AI such as Pearl. Again, I love the colors. I love the colors, and patients love it too. When you pull it up, that is so colorful, so visual, that patients will pay attention automatically. Just the colors, just how great it looks and how visual it is, patients will pay attention to that. Talking about calculus, this is not just about cavities. This is about calculus as well. Honestly, I don't see the calculus here. My eyes, I can see it right here, but I don't see every spot. So I love help of AI showing it to me and pointing out what I'm not seeing. The patients feel the same way. And it's not about just cavities. It's not just about cavities or calculus. Pearl AI has an ability to show more than just talking about cavities or gum disease. It actually allows you to utilize CBCT segmentation as well. And it allows you to talk to patients about orthodontic cases, airway treatment, and even talking about root canal treatment as well. And to talk about potential implant placement or bone health for those patients that do need dental implants. So this is so much more. You can use it for so many more treatment options. And again, you can do it for oral surgery, you can do it for orthodontics, airway management, failed root canals, periapical radiolucency, bone level. So this is just amazing how much visual we can provide to patients to increase that confidence in needed treatment and increase that case acceptance. What is rule number 3? Despite using visuals and really having that power of a visual presentation, we still humans working with humans. We have to remember importance of human nonverbal communication. For example, when we present the treatment, I always tell my hygienist and my doctors, sit your patient up, present it eye to eye, because if a patient leaning back, and we're sitting above the patient feels that the patient may feel that we feel superior to them, and that will decrease the case acceptance. So I always remind my human teams that it's great to use the visuals, but we really want to remember those chairside manners of a healthy nonverbal communication. So sit your patients up at the eye level. Watch your body language, because really people will see if you relaxed and how is your body language. So make sure your body language represents positive communication. And facial expressions, I always remind my younger female doctors and hygienists, when you're talking about something like a gum disease and cavities, make sure you don't wrinkle your forehead and you have neutral, calm demeanor, because we're talking about some dental treatment and showing pictures. And if we start wrinkling our forehead, patients may perceive that we are, disgusted with them or we don't like them. So it's very important to watch our facial expressions and to keep it neutral, calm demeanor. So again, it's great to use visuals, it's great to use AI, but don't forget that human, healthy, nonverbal communication. Rule number 4, again, coming back to Instagram and TikTok, keep it simple and short. Think about the social post you never read. Think about it. You go to your Facebook feed or Instagram feed late at night, and if there is a long social post, you don't read them. You really scroll and skip them, because we don't want to read a long text. We want engaging, fast, and easy for our brain to process. So that's why when we talk to patients, try to keep your sentences short and really use everyday language. Don't use words like periodontal probing or endodontic treatment or periodontics. Use the words that patients can understand, and avoid filler words like stop or and really skip the dental jargon. So keep it simple, professional, and short. And rule number 5, schedule next appointment and present finances confidently, because when we schedule appointment, we actually commit patients to doing the treatment. So when we educate and use visuals and really convince a patient that the treatment is needed, we want to make sure we schedule that patient. And while after scheduling them, we always want to make sure we discuss payment options and give payment options to our patients as well. And if they have insurance, we really want to make sure we use those insurance benefits. I do have to say I love Claim Check with Pearl, because it allows you to get those insurance claims optimization and get those insurance breakdown very quickly. So this is a great service to rely on, and the days of where you have to call on those insurance benefits are over. So this is a great way to help you to have that financial discussion prepared quickly by relying on Pearl insurance verification. So we can close an attention gap. Obviously, we have barriers to treatment. We have patients in our chairs that needs a treatment, but may not be, they have barriers, they have a short attention span. So it's really comes back to 5 rules you can implement for yourself and for your team to increase treatment confidence and case acceptance using AI Advantage. And the reason I say using AI Advantage, because I used these rules for years. And now with the AI, it just makes it so much easier and so much better and so much more powerful. So I do say 5 rules plus AI Advantage. So rule number 1 again, explain the problem and the consequences and a solution only at the end. Use visuals every time, every time. Use human, positive, nonverbal communication. Keep your explanation simple and short, and present value first. Schedule with confidence. Always schedule your patients for the next treatment. But case acceptance is a team sport. It's really the team sport. If you get excited and you go back today and you really say, okay, people, I'm going to be doing a really good job in a case acceptance, just doing things that I described will help you to increase case acceptance for your patients. But case acceptance is a team sport. You can literally go from 45% average case acceptance to 70, 90% if you work as a team. So how do we work as a team? We work together with a hygienist, dentist, assistants, and admin team. And I will show it to you really quickly how. So again, with the clinicians, we can use AI in the back, and with admin team or business team, we can use AI up front. We can actually print out those treatment plans. We can use AI to help us with insurance benefits, so we can communicate finances quickly and confidently. And we can use AI to help us to know who needs to be scheduled for uncompleted treatment. We can use it in a clinical, and we can use it in a business area as well. So I will show you. Again, 5 rules and 5 blocks. I want to remind you that really high case acceptance comes down to is using visuals. It's truly, if you can do one thing after today, use visuals. And AI, visuals using AI is the best. So that's really, if you can remember one thing today, if you say, okay, I don't quite remember what the 5 rules, just remember one rule: visuals and using AI. Before I had an AI, I would use intraoral cameras, atlases, pictures. AI is so much more powerful because number one, it is great visual, but also more and more patients think that AI knows better. So that's really psychological, like a psychological belief that patients think that AI knows better than a dentist or a hygienist, and they trust AI often more because AI is neutral. So again, not every patient, but as we progress in the AI era, that's going to be more and more the case. So if you remember one thing, use visuals and AI. Again, let's talk about the team sport. I love hygienists, so I always talk about hygienists. I always talk about hygienists. I always said that if I can rule the world, hygienists would be by my side. And here's why. They're super intelligent. They go to school for a long time. They care about they care about their patients, and patients trust hygienists often more than they trust me as a dentist. So I love working with a hygienist. So I feel that the heart of every successful practice is a hygiene department. So I feel that hygienists should be using AI. And again, hygienists cannot diagnose, but hygienists should and can educate. So by using AI, hygienists become a powerful educators, saying this is what I see here, but the doctor will come in and confirm it, but this is what AI is showing me today. Again, using AI empowers hygienists with any experience, any amount of experience. Maybe they're just newly graduated from hygiene school, or maybe they have been doing hygiene for a long, long time, AI allows them to see things regardless of their experience. So this is really becomes a powerful tool for hygienists to use. I love it. Again, it helps hygienists. Hygienists are very busy. They're very busy. There is a high demand on hygiene schedule. So it's very nice to have AI tool that helps us to know if there is any patients with outdated periodontal charts. And because periodontal health is super important for overall health, and it's extremely helpful to have an AI assistant hygienist, and Pearl AI does it. So this is really wonderful. Also, this is not just about a clinical team. Again, case acceptance is a team sport. So when patient goes up front, it's very nice for administration team to utilize Pearl to print out a summary of a treatment presentation, to get insurance breakdown, and to really submit those insurance claims so they don't get denied, and the office doesn't have to spend extra time and energy dealing with denied claims. So this is really wonderful. Again, Pearl AI is really not just for the clinical team, but to support administration business team as well. And really, I believe everybody should be using insurance verification. I worked upfront. I know how long it takes, and it's really should not be happening that there is a human calling an insurance anymore, unless it's a specific case that cannot be verified by AI. Really, that's needs and should go, because insurance verification takes a long time in each office, in every office, and it's just so much easier for AI to do that and to support us so we can actually focus on a patient care. If I ever had to work up front again, that's would be my must for AI to do insurance eligibility. And again, remember that I love to talking about AI, but insurance is using AI. So we really need to have a new way to submit those claims so they don't get denied. And again, if our claims get denied, it does affect case acceptance, because a lot of patients will get upset with our dental offices and they will blame us. So the best way to keep patients coming back and trusting us and have that high case acceptance is really, even after they leave the office, and making sure that those claims don't get denied. Because if a claim gets denied, most insurances will send a letter to the patient saying that the treatment was not approved, and then a patient thinks that we misdiagnosed and over-treatment plan. So it's very important to submit claims correctly and prevent those denials, to make sure our patients are keep coming back, trusting us, and have a high case acceptance for the treatments that we describe to them. And again, this is really every day when you start the day, you can go through the schedule, and AI can help you to identify and schedule treatment, identify and diagnose treatment, patients that need x-rays, and identify patients with overdue hygiene. This is amazing. This is like, I wish I had it when I was practicing every day, for somebody to help me, for an AI to help me instead of me clicking on every chart. And sometimes between 3 to 4 hygienists, I had over 70 to 80 hygiene patients, and plus my patients. So sometimes the practice had 80 to 90 patients per day. So this is just a wonderful tool to have. Again, seeing is believing. When we allow patients to see, going back to case acceptance is a team sport. And while we all work together, and it comes back to seeing is believing, if we show patients what they need, we can actually help them to increase treatment confidence and increase case acceptance using AI Advantage. And again, it's a team sport, but it's very important to remember that we still work with humans. And really, humans respond really well if we use 5 rules to increase case acceptance. And again, with humans, most humans have common barriers to dentistry. They don't want dental treatment. They don't think they need dental treatment because of a lack of symptoms, or they don't see the problem. Most dental treatment is expensive and insurance coverage is very low. Plus, patients are bombarded with messages. Everybody's competing for patients' attention, which is already very short. Our patients' attention is very short, and everybody's competing for their attention. So here we are. We have to use the rules to make sure we approach our human patients, understanding that if we use those rules, we can help them to hear us and complete the needed treatment for their dental and overall health. So I want to test your eyes. Seeing is believing. And guess what? Good, sweet benefit from you, for you guys. Anybody that will win, you actually, we will play a game. And if you win, you actually will get a $50 to Amazon. So this is really easy to do. Scan this QR code, and it's very easy. This next screen will come up. I will leave it up. So scan this QR code. And after you scan it, it's very easy. You will click add cavities, add perio, and then you will see it doesn't take long, and it's very easy to do. And the highest score will get $50 gift card to Amazon, and you can put it in a chat. I guess we will know who gets that high score. So is everybody doing it, Sheila?
Yeah, I think we're getting people logged in. So we're going to play live, guys. If you can just scan this real quick, enter your email so we know the top winner. And it'll take a couple minutes. You just play right along on your phone, and we'll announce the winner at the end. Feel free to click on those areas of concern, and you can also delete if you click the wrong one. So it'll probably give you just a couple minutes here. But yes, make sure you're scanning the QR code because that will be the best way to jump in there.
And that's very easy to do. You can add carries, and I will play with you because it's really, let me just make it a little smaller so I can, I'll play with you just because I think. So if you add carries, and I have to say, I've been practicing dentistry now for over 20 years, and sometimes my eyes get really tired at night. So as a seasoned dentist, many of you can relate and say, I know how to detect caries. I agree, you can, and I can as well. But sometimes if I wear my big loops and I see so many patients and I have to do hygiene checks, and my eyes are really tired by 1 o'clock and 2 o'clock in the afternoon sometimes. And sometimes I miss cavities. I cannot tell you the amount of days where AI pointed out to a cavity and I said, oh, thank you. Like, thank you. Just thank you. I am blind at this point. So again, I can obviously see these, but there is so many times where I may miss a cavity because I'm tired or I'm just bombarded by the busyness of my schedule. And obviously calculus and margins are always hard to see sometimes. So I really appreciate noticing the failing margins. And I do appreciate noticing that periapical radiolucency. But what I appreciate the most, again, is that visuals that helps me to see, but then I show it to patients, making that presentation visual and very powerful. How's everybody doing with that? This is a really hard x-ray. Would be a really hard x-ray, especially for a hygienist that maybe have not been practicing for a long time. And if I want my hygienist to, to go over this visual with a patient, it would be really helpful for my hygienist to know that, hey, there is a cavity. And I don't see the calculus here. So again, that would be super helpful even for me as a dentist to see that calculus. And for margin, that would be really good to show the failing margins. And for periapical radiolucency, obviously it's here and it's here as well, but also this one is failing as well. So really, this is really important because again, we are busy professionals and we're humans. So it's nice to have an AI to point to all of those differences quickly and really to back me up. And then when I come in to the patient, when I come in to do an exam with a patient, it's so much easier pulling up a visual and pointing this out. And especially if my hygienist already have done it, or even maybe my clinical assistant showed those areas using AI. So I'm gonna go back to presentation. I'm gonna go back to presentation and again, you guys can scan it. So what am I working on next? Obviously, I implement AI. I talk about AI. I love Pearl because Pearl has my trust score. What it means that at Intelligent Care Alliance, we work with a lot of AI companies, but we really only work with the AI companies that have a high trust AI score. What does it mean? It's scary to bring AI company to your office and to your patients. So we really help offices to bring AI companies to that have a high trust score. And Pearl has that high trust AI score. How did they earn it from my agency? Number one, accuracy of findings, how long they have taken to train the AI, and how much they work on getting that AI better every single month. The Pearl is constantly working on teaching and improving the AI abilities. They have new features coming out regularly to support dental teams. And because of that, they do have a high trust score from Intelligent Care Alliance and from my company. If you're not sure how to bring an AI to your office, my book is out and you guys can scan a QR code. And it's really quick way to show you how to choose AI and how to bring AI to your practice today. It's actually really funny too, because it was really hard to write a book about AI, and I didn't want everybody to fall asleep while they're reading it, so I made it really funny too, but professional. So you guys will enjoy it. It's short, it's sweet, it's to the point, and it's funny. And it's really, there is no fluff in it. There is what you need to know about AI as of today. And again, I want to thank again Pearl and Patterson Dental for bringing this webinar to you. And again, I want to thank some of my AI helpers to help me, ChatGTP, Gamma AI, LeChat for making images. And again, my amazing team at Intelligent Care Alliance. They're much smarter than me. I just have to tell you that. They're much smarter than me. And they're all guys except one girl. I have one girl that is an implementation specialist, and the rest of them are guys. So we need more girls on my team at some point. But anyway, so thank you so much. And we have some time left for questions.
Thank you so much, Dr. Alderman. That was so wonderful to have you walk us through all of that. And just can't thank you enough for making it so simple. We all present dentistry every day, and we're all pretty good at it until we look at another type of image that has colors on it, which is very simple, and think, wow, this can be even easier, not only for ourselves, but for our patients, right? So they can, I remember in hygiene, when I would take that kind of similar to that image you showed, where there's so many interproximal areas, and I would be thinking, this is a Gatorade soccer player, right? Where they're just drinking Gatorade all day long. And my worry wasn't how are we going to, talk about the treatment, but fast forward 2 years. We don't want them coming back in 2 more years with, 4 more interproximal lesions. And, moms and dads that are looking at kids with areas of decay too, they're concerned. Like, well, how do
Yes,
I believe you, right? There's 10 cavities. What are
yes.
you talking about? Especially if it's a new patient. So I love how you walked us through really the those 5 steps, and they're great reminders for our teams that patients, it's as if we need to talk to our patients as we would talk to our friend at dinner. Well, you have 2 cavities, they're in between your teeth. You need to think about getting a filling while they're small, and that was a reminder for me when I was learning about case acceptance from one of my mentors. I know we have a winner, so we'll announce the winner.
Tell us a winner. Who is a winner? Is it a
Well,
hygienist? Who is it? I want to know.
I'm going to keep it secret for just a minute, but I do want to make sure we answer some questions. I do want to make sure we spend some time on this QR code too. I think this would be a really fascinating book to be able to really have somebody who's gone through and been looking at all different companies, understanding AI, and really seeing how it works in a dental practice. So I encourage you to think about um, scanning that code and reading this book. As you can see, Dr. Alderman makes AI very fun. And then also in just a moment, I'm going to put a QR code up for you. If you're interested, I would invite you to set up a demo with your team and Pearl to be able to see, hey, would this be um, a great
You want
way
me to stop
to
sharing,
increase our
Sheila?
case
You want
acceptance?
me to stop sharing my
Oh, in
screen?
just a couple minutes. I just
Okay.
want to make sure they have some time to scan your code. But yeah, we'd like for you to set that up to bring your whole team and bring your hygiene team, your front desk team, and I'll share in just a moment. I know Kimberly is going to be joining us in just a second here with some questions. So we're thankful to have Kimberly, even though she's a little under the weather today. Thank you, Kimberly, for joining us.
It's
And
good to remote work.
feel free to let us know what questions the teams have for Dr. Alderman or Pearl questions.
Yeah, perfect. Thank you so much. Lots of people saying amazing information. They can't wait to share it. So that's great news. Thank you for that. Um, Interesting question right out of the gate. How do we compare Pearl features versus other AI providers?
Great question. Ask me. That's and here's why. Because then I just had that conversation with every company, every diagnostic AI company. I don't exclusively represent Pearl. I work with all AI companies. My Intelligent Care Alliance, we are ecosystem with all AI companies. So we really work with all AI companies, and it's all about getting that AI trust score. And again, I mentioned the AI trust score, and Pearl has earned that AI trust score based on years of developing the product and still developing and training it. And where's my AI trust score comes from? I don't just I don't just talk about AI. I create AI, and I went to MIT AI school, so I understand how the AI created. I understand how robots work and what language they speak and what does it take to speak to an AI and how to create AI. I am as geek as they come. That's that's really so. Ask me, and really, you can always take energy and time to look and demo all of the products, but truly, you don't know how to demo it unless you test each one of them for a period of time, and it's expensive, it's time consuming, and your team may not have time or energy or desire to do that. So again, if you Pearl is a great company to use, and there are other good companies too, but really ask me. That's my answer to you.
The
That's
other
what
thing
I
I'll add is see it for yourself. Click the QR code and
Yeah,
and test it out
exactly.
for yourself as
Yeah,
well.
test
Yeah,
it for
for sure.
yourself. And again, and I always say, read my book, because really, when we talk about AI, and I get that question every single day, how do I choose AI and what AI bring to my office? And my number one question, what problem are you trying to solve today? What problem are you trying to solve? So then I'm going to talk about what AI you should bring, but most dental offices have one common problem: lower case acceptance based on the barriers I described. Almost every single dental office has a lower case acceptance unless they're really good and being proactive about using the rules I described. And because of that, for most dental offices, bringing AI diagnostic is always helpful because it immediately increases case acceptance and a patient's conversion from treatment plan to completed treatment. So anyway, longer answer, I'm sorry.
No, that's okay. That's okay. Sort of
Great.
following up on using it with case acceptance, there's been a couple questions about specifically the dental team and how dental teams, whether they're clinical or not, how has that been for the team to adapt, and have there been benefits to them, you know, especially if they don't have a dental background? Can you speak to a little bit of how that can help?
Fabulous question. I love that question. And I always say that no matter what AI technology you decide to bring, work with your team first. You may be super excited about bringing this AI technology to your office. You may attend this webinar and say, Dr. Kathryn Alderman got me excited about bringing this technology, yet you will meet resistance from your team. And here's why. How do you change that? First of all, describe the solution or describe the problems that you're trying to solve. Then show how easy it can be and how can it help patients, how can it improve your workflow in a dental office. And always, always bring one technology at a time. Don't do more than 2 or 3 AI products. Only start with one. Start slowly. Talk to your team. Explain why you're doing it. And I promise you, that will stick. That will be used. And your team will start using it and loving it. But so start with one product only. And again, before you even bring that product, sit down with your team, order pizza. Everybody loves pizza. Everybody. Everybody, all order Starbucks and say, hey, can we talk about AI today? Have a lunch and learn. Talk to your humans. Your humans want to be communicated to. Talk to your humans. Sit them down. Buy some food. Everybody wants food. Everybody wants food. So buy food. They will listen to you. They will listen to you. And sit down and talk to them why you're thinking about bringing something. And then show how easy it is. And again, the change with the AI, the biggest thing with the AI, you don't need training to use it. I always tell my clients, AI does not require training. If AI requires a lot of onboarding and training, that's a problem. We bring in AI to support and decrease the workload instead of increasing the workload. So in regards to your question, regardless of experience, AI can be helpful because AI is very easy to implement. But again, you have to have your team on board and excited about it. And that's how you do it. So get food, tell them why you're doing it, tell them what's the benefits of doing it, and bring one AI product at a time. You will win. And the moment you do that and your team sees the benefits, then you can bring another AI product 3 months later. 3 months later. And then 3 months later, you can bring another AI product. And before you know, your team is feeling so much more supported and your AI office.
Love it. Any more questions, Kimberly?
No, all good. I was hoping, I was wondering if you had any insight also in the way you've worked in teams and watched and worked with many teams adopting this technology. Can you speak to your experience as well, Sheela?
Absolutely. I think we all have, especially as owners, fear of change. And we've all experienced going to a convention or a webinar and purchasing something, and we're all excited. And then we bring it to the team, and it's, you know, oh boy, what do I need to do? I need more time. How is this going to help me? And I think the best thing about AI, Dr. Alderman was speaking about, is it really does help everyone on the team, and most importantly, saving time. And what I mean by that is we're all struggling right now just to complete what we need to do in an hour or half hour, and being able to have simple technology audit charts for you, or identify cavities on radiographs, or verify insurance. In that product, you're going to get time back that you can spend with your patients. I think that's really crucial. As far as a learning curve, I always love the fact that we're already taking x-rays and we're already showing x-rays to patients. So I think to go back to the first question about Pearl and competitors, it's important to know that Pearl is embedded, not just integrated, but embedded in a bunch of different imaging systems. So we're proud to say that not only are we in over 120 countries, but we are in over 30 different imaging systems and integrations. So that makes your workflow very seamless. And I think that's a huge advantage to going with Pearl. So we would love to invite you to see how Pearl can make your day easier, make your patients accept more dentistry, and allow you to do what you love best, which is spend time with your patients. I think we're ready to announce the winner.
I'm excited. I want to see the winner.
Kimberly, do you want to do the...
No, let it be all you, Sheela.
Okay, so let's see if they're still around. I don't want to mess up the name, so let me just double check here. Say it correctly. We have Michael Landry. So Michael, are you still here?
Michael's here.
Right.
Congratulations, Michael.
Michael, are you a dentist or what position are you in? I'm really curious because I love when hygienists win and the clinical assistants. I love it.
Michael, there you go.
A dentist? Really good job. Good job.
Excellent. I love that. Well, thank you so much for playing the game. Please join us for future webinars with Pearl. We will have Dr. Alderman back as well, probably in an evening, so we can spend some time doing kind of after hours with Dr. Alderman and go into more in-depth about AI. We would love to have you join our website at hellopearl.com, either for a demo or also to see all of our on-demand webinars, and our future CE Study Club will be coming your way as well. So thank you all for joining us. Thank you, Dr. Alderman, for spending time with us. We know how busy you are. It was such an honor to not only have you today, but again, to work with you over the last couple of weeks. And I know this is not the end. So thank you so much.
Right back to you. Thank you to everybody for attending and taking your time. Thank you, Kimberly, and thank you, Sheila. I really appreciate you all. Thank you so much, everybody, and I will see you around. I'm everywhere on socials. Bye.
Goodbye, everyone.
Bye.